Good morning, everyone. Thanks to our followers on Facebook Live. I'm here at the Mariposa Community Health Center in Nogales, Arizona, from our main building conference room with Edgardo and Marco. Thanks to both for making this possible. Also want to thank our leadership for supporting this activity. My name is Eladio Pereira. I'm the Chief Medical Officer, and this is our weekly Facebook Live session from Mariposa. Today is Friday, October 16th, and we'd like to take a few minutes to give you an update on a few things that we think is important, particularly related to COVID-19, and this is part of our education piece that we'd like to do to connect with our community. Again, I want to thank our colleagues and our entire Santa Cruz County for supporting Mariposa over the last few weeks during the COVID-19 pandemic. My goal this morning is to review a few items regarding COVID-19 and then cover some areas of COVID testing. The first component of today's session will be regarding some of our efforts at Mariposa, but also our awareness about COVID-19 and what's to happen in the next few weeks. And I will refer to various interviews that experts have conducted recently. Specifically, Dr. Anthony Fauci at NIH on October 14th, where he reviewed the anticipated few weeks, which in my view are very telling and support the idea that prevention is the best tool to manage COVID-19. Therefore, I will refer to some of his comments during the interview. We know that as a few days ago, there were about close to 8 million cases of COVID-19 in the country, and unfortunately about 220,000 deaths or so. It is anticipated that by November 7th, we'll have about 240,000 deaths in this country. Therefore, the largest number of deaths in the world. We are starting to see a surge in cases, therefore an increase. Dr. Fauci anticipated that at the moment, or at this time, we would have about 10,000 cases a day. Unfortunately, we're seeing over 50,000 cases in a single day, and in some areas of the country, the number of cases per day reflect the same numbers going back to August, after seeing a decline in cases in the last few weeks. Therefore, what we're seeing is 4 to 5 times what we anticipated, and that's a concern. At the same time, we're seeing that about 30 to 37 states are seeing an increased number of cases with an increased number of hospitalization and death. All this is evidence that our best tool to manage COVID-19 is the use of masks to reduce the inoculum and increase the possibility of being asymptomatic should you become infected. Number 2, reduce close contact, household gatherings, and large crowds, meaning social distancing. Conduct outdoor activity as much as possible, and of course, wash your hands. Testing continues to be a tool that we use. Dr. Fauci and others have commented that testing is helpful in terms of reducing anxiety, knowing that a negative test can help us in various ways, understanding that there are false negatives in some instances. We are seeing an increased number of tests in the country using either the PCR or the antigen. It is our hope that at some point home testing will become available, such as the pregnancy test. And Dr. Fauci has commented on that as well. It's still unclear what the COVID-19 vaccine will look like. We do know that trials are being conducted and that more information will become available in the next few weeks. Again, prevention is the key to manage or mitigate the spread of COVID-19, and not only that, the identification of positive cases to begin isolation and reduce transmission to others. We get a lot of calls about testing, and clearly the management of COVID-19 continues to evolve depending on various factors, including the severity of illness, whether it's mild, moderate, severe, and whether the patient is in the hospital, on the floor, or the intensive care unit. And we do know that a lot of attention has been placed on hospital-based treatment with remdesivir, convalescent plasma, and monoclonal antibodies. We do know that hydroxychloroquine is not clinically effective. So it's best to prevent the illness. Testing only identifies people who are already infected, and thus they have an increased possibility of becoming sicker. And as we know, this is an illness that can affect individuals over time. In some patients, it takes a while to become ill. So a testing-only strategy is not recommended. We do know that wearing masks, keeping social distance, and washing the hands is the most effective way of mitigating this infection. So a testing-only strategy has been promoted in some cases. I would refer to information given by Dr. Rob Murphy at Northwestern and Dr. Baton at University of Washington, as they have carefully reviewed the strategy of just test as frequently as possible, keeping in mind that a test can identify someone who's actually infected. We do know that the test-only strategy really doesn't work, as we have seen with the recent cases, individuals who were tested frequently and then become positive, particularly if they have not taken the proper prevention strategies. The experts indicate that this is very similar to Russian roulette. So it's not a prevention strategy at all. We know that testing doesn't keep people safer. The only way to keep us safe is to follow the recommendations I outlined earlier. We do know that the purpose of the testing is to contain the infection. That's well known. And we do that by reducing transmission to someone else. Once a test is identified as positive, we'll begin isolation with the intent of reducing transmission to someone else. If we depend only on testing, there's a great possibility of failure, and that's been shown. One of the ways is the fact that this test has a false negative rate that can vary from test to test or manufacturer to manufacturer. This is particularly prevalent with the rapid antigen test compared to the PCR. The false negative rate with the rapid antigen test it's higher in people who have no symptoms, in the asymptomatic individual. It is fairly specific, but certainly not sensitive in a symptomatic individual, and that's important to recognize. The test itself becomes more sensitive usually at about day 5 to day 7 of developing symptoms. So we do know that there's a false negative rate, particularly with the rapid antigen test in the asymptomatic person. The way testing can be a failure if we depend only on testing is that people do not test positive immediately after becoming infected. It takes a few days for the virus to enter the body and replicate and develop symptoms. So typically, we start having positive tests at about day 3, 4, or 5. So therefore, it takes a while. If you become tested immediately after exposure, you may have a negative test and still be infected until you develop symptoms. So we know that you begin with a viral count essentially of 0, and then it goes up, and the sensitivity of the test essentially depends on the load of the virus that you have. There is a lag time between becoming infected and the positive test. And sometimes we forget that. Sometimes we want to be tested immediately after being exposed, and that can be done, but keeping in mind that in some cases where a negative test occurs early on after exposure and symptoms develop a few days later, that in that case it may be necessary to retest the individual or not test at the beginning and wait for a few days or quarantine the individual. So there are a few strategies that we can use depending on the situation. And the third piece is what they call system failure, meaning that sometimes we don't manage the data correctly, we ignore the data, we ignore the positive test, and we don't do isolation. So we certainly, that's a personal choice, but it's part of the system indicating that we need to interpret the data correctly, and in addition, the individual needs to understand what the data entails and what actions need to take place. Therefore, the purpose of testing is to diagnose people who are infected and isolate them to prevent spread of the infection. As many have said, our public health experts say the best way to prevent SARS-CoV-2 infection is by proper use of the mask, social distancing, and washing our hands. A few experts have said that we cannot test our way out of this, that it's all about prevention. I'll take a few moments to speak Spanish for those who are Spanish-speaking only followers, and then I'll finish with a few comments. Mis comentarios iniciales se refieren a varias entrevistas que el doctor Fauci ha conducido en los últimos días. Sabemos que en este momento hay aproximadamente 8 millones de casos en los Estados Unidos, cerca de 220,000 muertes. Se anticipa que para noviembre 7 hayan 240,000 muertes, desafortunadamente. Se anticipa un aumento de casos, estamos viendo en algunos estados ese aumento. El doctor Fauci anticipaba 10,000 casos positivos al día y últimamente se han reportado 50,000 casos al día, que es entre 4 y 5 veces lo que se anticipaba. Entre 30 y 37 estados han reportado un número alto de casos y el número de hospitalizaciones y muertes ha aumentado. Eso es evidencia de que las estrategias preventivas continúan vigentes: el uso de la máscara, mascarilla o tapabocas, evitar las congregaciones, evitar el contacto cercano y lavar las manos. El doctor Fauci habla de las pruebas. Es importante hacer las pruebas, pero como parte estratégico del plan. Reduce la ansiedad y nos permite interaccionar un poquito más frecuente. Desafortunadamente no tenemos las pruebas suficientes para hacer pruebas con frecuencia en toda la población. Él propone quizás una prueba que podamos hacer en la casa, similar a la prueba del embarazo. Hablamos de la prueba en términos de una estrategia. Sabemos que la solución a COVID-19 no es solamente el examen o la prueba. La solución es preventiva. Sabemos que la prueba tiene problemas. La prueba no mantiene las personas más seguras. El propósito de hacer el diagnóstico es contener la infección, mitigar el efecto de la infección y reducir la transmisión a otras personas. Hay 3 maneras en que las pruebas se pueden malinterpretar. La primera es el porcentaje de negativos falsos, particularmente con la prueba de antígeno. La prueba de antígeno rápida en pacientes que no tienen síntomas, quizás no tiene la sensitividad que tiene otras pruebas, y sabemos que la positividad de esta prueba aumenta después que los síntomas aparecen en el día 5 o día 7. La segunda manera es que mucha gente no es positiva, o la prueba no sale positiva inmediatamente después de adquirir la infección. Hay varios días que toma en el virus replicar en el cuerpo para que haya suficiente virus para que la prueba salga positiva. Hay un tiempo entre adquirir la infección y que la prueba salga positiva. Y la tercera manera en que esta estrategia de pruebas puede fallar es una falla de sistema, donde la prueba no se interpretó apropiadamente o la persona no acepta los resultados, y en lugar de aislarse después de una prueba positiva, puede infectar a otras personas porque no está aislada. Lo más importante de la prueba positiva es aislar los pacientes por lo menos 10 días o más, dependiendo de otros síntomas que estén presentes. Y finalmente promovemos el uso de máscaras, mascarillas o tapabocas y mantener la distancia social, ¿no? La solución a COVID-19 no solamente la prueba, sino es la prevención. My final comments will be mostly on prevention. I want to remind our followers about the importance of the influenza vaccine this year. More than ever, we want to reduce the burden of respiratory diseases in the country, and one way is to vaccinate against influenza. In other countries, we have seen a decrease in the influenza cases because of the mitigation strategies, such as masking. So hopefully we will not have the burden of influenza as other years because of masking, prevention, or the preventive strategies, and of course the influenza vaccine. Finally, I want to make a brief comment about our mental health. In our medical journals, a lot of articles are written about mental health of patients and doctors and other healthcare providers, nurses, etc. A brief comment that we all need to be alert to that. I think social distancing doesn't necessarily mean that we need to be socially isolated. It's important in times of distress, whether it's a community-wide effort or at the more personal level, is to practice kindness to each other and practice humility. I think COVID-19 has shown us that knowledge is always incomplete. We'll never know enough. It looks like every day we know a little more that can help us manage this pandemic, but I think this applies to all medical knowledge. We feel very comfortable sometimes at what we know, only to learn the following day that what we knew a few days prior was wrong. So I do promote being kind to each other, practice humility, and support each other in time of need, particularly COVID-19. Mis comentarios finales tienen que ver con la importancia de la humildad y la gentileza, particularmente en esta pandemia, cuando todos estamos afectados hasta cierto punto u otro. Sabemos que el conocimiento en la medicina es incompleto. Siempre adquirimos ese conocimiento y nos damos cuenta que lo que sabíamos hace unos días atrás estaba incorrecto. Y eso nos da un momento de pausar y pensar que para poder manejar todo esto, la humildad y la gentileza es muy, muy importante. That's all I wanted to cover today. I want to thank all the followers on Facebook Live. I want to thank our Mariposa staff for making this possible. It is always a privilege to be able to address each of you on Fridays. Please be kind to each other, practice humility, and help each other. So, thank you very much. We'll see you soon. Have a great weekend. Take care. Bye-bye.
Transmitiendo nuestra comunidad al mundo.